Actually, today we are going to tell something or discuss something about glaucoma, not the internal depth of the glaucoma, but mostly for the people, for the patients, for the general people, on the point of awareness of the glaucoma, how we can take the challenge against the glaucoma. Actually, glaucoma, before we start, tell something, let me tell a story. On the day when I was in my clinic, a patient came to me. His name is Mr. Debashish Maulik or Debashish Chakraborty. He's aged about 65 years. He's a retired professor from a college. His complaint was nothing serious. He came to me and told me, see, Dr. Sarkar, just check my eye and give you good power so that I can read everything properly. I asked, what is your problem? When you took your last glass? He told, I took it about 2-3 years back, but at present, when I go to read something, I feel some headache in my front head, a pain in the front head, and I need more light to read, and I become tired. I become tired after reading for 10 or 5 to 10 pages. So I examined the gentleman. I saw his vision is very good. He can see up to the last line of the semester, that is 6 by 6. But when I proceeded with the other procedures like pressure of the eyes, like check the retinal position, I saw that surprisingly I saw that his pressure of the eye was very high. Usually eye pressure, which I shall discuss after some time in my discussion, usually eye pressure is a range between 12 millimeter to 17, 18 or 20 millimeter. But his pressure was more than 25 millimeter. And when I did a test, which is called the field of vision test, just how much you can see in the field. I saw the field of vision is narrow. And I did other tests, and I told him, Mr. Shanal, unfortunately, you are suffering from a disease which is called glaucoma, and it is a vision threatening disease. So this is glaucoma. And another story I must tell before going to discussion, because it is also related with the disease of glaucoma. A patient is like about 55, 56. He came to not to me, to another doctor, general physician, with the complaint of headache and vomiting, and slight redness of the eyes and mild pain in the eyes. General doctor or the physician gave him medicines to reduce the pain, to stop the vomiting, to this and that. Still, the vomiting did not go. In some coincidence, the patient came to me, to my clinic for opinion about his eye. I saw that his vision on one is almost gone, no vision. Eye pressure is stony hard. This is more than 50 millimeter mercury, and there's intense redness around the eye. So this is another type of glaucoma. This is called the closed angle glaucoma. With the introduction of the two glaucoma, I am going to discuss my first discussion about my nutshell on glaucoma. So glaucoma is a silent theft of the vision. Now, what is glaucoma? Glaucoma is condition that damages the optic nerve of the eye. What is the optic nerve? You know, there is several layers inside the eye. One layer is nerve fiber layer, and this layer is responsible for the vision of us. So glaucoma is the damage of that nerve. So that damage of the optic nerve leads to the damage of vision and low vision. And glaucoma gets worse at time. It is a very slow progressing disease, very slow progressive. If it starts today, maximum outcome comes after many years. So patients do not understand the gravity of the disease, glaucoma. So it is very long-term disease. It is because of increased eye pressure inside the eye. Our eye has a certain amount of pressure. The pressure when increases, the glaucoma precipitates. Glaucoma has a strong family history. So if any person of the family, senior person of the family or somebody is a glaucoma, the other people may suffer from glaucoma. And most of people do not realize or recognize the problem in the beginning. So glaucoma is a disease which we doctors diagnosis, and we doctors diagnose and start treatment of the glaucoma before the patient can understand that he has glaucoma. Next, mechanism of vision. This is a very nutshell. I'll tell you how we can see. When light rays falls on eye, after passing through the cornea and lens and this and that, it focuses on the retina, which is at the back of the eye. And the retina is a complicated nerve fiber layer. There's many type of nerves in there, and when light rays falls on the retina, a photoelectric impulse generates. A photoelectric impulse is a very complex mechanism. Photoelectric impulse means the light rays converts to electric rays, impulse. That impulse via the optic nerve goes to our brain, and we can see. What is the pressure in the eye? In my discussion, I'm frequently telling, and will tell about the eye pressure, IOP. Our eye has certain internal pressure, which is called IOP or intraocular pressure. Why this pressure? You know, eye is very soft, and it is situated in the cavity of the eye in the skull. So if it needs some internal pressure to keep the eye in perfect position. So if there's no pressure, eye sinks. You cannot see anything. I do not work at all. So some pressure inside the eye, which makes the eye in its own position, and that is help the vision. This pressure, how this pressure generates? This pressure generates from a circulation of a fluid inside the eye, which is called aqueous humor. Inside the eye, you know, there is a fluid. There are two compartments. One compartment is small, which is called anterior compartment, which is in front of the eye, and another is a big compartment, which is back of the eye, which is called big compartment. So in the anterior compartment, there is a liquid called aqueous humor. This aqueous humor causes the pressure of the eyes. So what causes the pressure of the eye? In the aqueous humor, from the ciliary body, this is also a mechanism. Inside the eye, there is a small tissue from where this aqueous humor generates. And the amount of aqueous humor generates, it automatically passes out the eye. Some comes inside the eye, some passes out the eye. Some fluid comes inside the eye, some passes out of the eye. So equilibrium is maintained in the eyes. So if this equilibrium breaks, so if the drainage is more or the outcome is less, the fluid will accumulate inside the eye and pressure is increased. So in any position where the production of the aqueous humor inside the eye is more, or the release of the aqueous humor from the eye is less, the pressure accumulates inside the eye, and this pressure can cause damage of the optic nerve. How the IOP, intraocular pressure, damages the eye? As I told, you see in the picture, in the green line means the aqueous humor is producing and coming out. When this light channel is disturbed, the aqueous humor is not properly balanced inside the eye, the liquid, the fluid, is accumulates inside the eye, and in the back of the eye, or the retina, this pressure, it causes pressure on the retina, and it damages the retina eye. So what is the cause of the glaucoma? Cause of the glaucoma, there is a small area in front of the eye called the anterior chamber, which I told you, the anterior chamberment produces the fluid, and the fluid passes out from the eye and makes the equilibrium. When equilibrium disturbs, the eye pressure increases and the glaucoma precipitates. Now, what is the symptom of the glaucoma? As I told you, there is no symptom. Glaucoma has no symptoms initially. Patient never comes with the complaint, sir, Dr. Sarkar, I have glaucoma. Glaucoma is diagnosed by doctor. So this is blood vision, severe pain, headache, rainbow color, nausea, vomiting, color rings, all is the last stage of the glaucoma. When the patient comes to us, none of the visions, none of the symptoms are there. When patient comes at last stage, then these symptoms occurs. I shall come to this point later. Glaucoma is a progression. In the early stage, glaucoma has no symptoms and vision remains normal. As I told you, Mr. Shanal came to me for his diagnosis of the glaucoma, for the eye problem. I diagnosed glaucoma and he had no symptom, he had no loss of vision. After some time, without treatment, if patient do not take care of the glaucoma, what happens? The optic nerve retina gradually becomes hampered, and the nerve fibers of retina becomes damaged, and patient gradually lost his vision from the outside, not the inside. You see, we see from our eye in the center position, but still you can see the other side. When I'm looking to you, I can look your face, but I also can see the other periphery of your side. This is called field of vision. In the glaucoma, gradually the field of vision comes narrow. And when it comes small, narrow, then patient comes to us with the complaint, Dr. Sarkar, I can't see anything. That is the last stage of glaucoma. So be careful. Last stage of glaucoma is very dangerous and it has no treatment. Last stage has almost no treatment. Third point, you won't find this black spot. Black spot means some patients can experience in the second or third phase of the glaucoma, there's a black spot in the field of vision. Sometimes coming, sometimes going. Sometimes coming, sometimes going. But don't mix it with the floaters. Floaters means small, tiny black spots floating in front of the eyes. That is usually symptomless and it is a age-related factor. So now comes to a different types of glaucoma. I told in the beginning, two patients came. One patient came to me with no symptoms, and one patient came to me with symptoms of vomiting, headache, redness of the eyes. So the first group of patients called the open-angle glaucoma. Open angle means the fluid which is coming, the aqueous humor which is generating inside the eye and passing through the channel is open. And the second is called the closed angle glaucoma. That means the angle from which the fluid passes that becomes closed, and the total fluid, aqueous humor, builds inside the eye and causes intense pressure and the pain and vomiting, etc. So the same type of glaucoma, and how glaucoma is diagnosed. So now I told you the patient has no symptoms, but we diagnose the glaucoma. How we diagnose the glaucoma? By doing tonometry, by that ophthalmoscope machine, by doing perimetry, by doing gonioscopy and pachymetry. Come to the other point. This is when a patient comes to me, we check his vision. Usually see the vision is blurred. This is an advanced case of glaucoma. In early case, patient can read all the lines in the chart. But in the advanced cases, the alphabets in the chart becomes foggy, hazy, as if looking through a moist glass or something, foggy glass. Next is intraocular pressure checkup. Intraocular pressure checkup is done by applanation tonometry. This small green thing is machine. The applanation tonometry is a small tube-like instrument which touches over the cornea. Before touching the cornea, we make the cornea anesthetic by giving some eye drop. When the tip of the machine touches the cornea and the reading comes in the machine, and we can see what is how much pressure is at the eye. Normal pressure is 12 millimeter to 20 millimeter of mercury. And this is the advanced machine called perimetry, automated perimetry, to check the field of vision. Sometimes, some minutes back, I told you the field of vision. Field of vision means when you look something in front, we can see also periphery of the field also. When you drive the car, you can see the right side, left side things, so that you can safely drive the car. But in the machine, automated perimetry machine, if you check one normal person, this is a picture of a normal person. See, the picture is white. The picture is white. There is no black spot. This is normal. Only one black spot is there. Black spot means optic nerve entry point. That is called blind spot. And what happens in case of glaucoma? You see the picture. The optic nerves will be damaged. This is the earlier picture. This is the area of optic. What is optic nerve? And in the glaucoma, optic nerves become damaged. Damaged means black spot, blacking spot of the report. And this damage cannot be revived. Be sure when a nerve is damaged in the eye, it never generates. So if this patient comes to me first, I can treat the patient. I can save the other part of the patient, other part of retina, but I cannot cure the black portion. Black portion means complete loss of nerves there. So before lodging the nerves in the retina, come to a doctor to rise. This is the field of vision. In a normal person can see total field of vision. See, with the glaucoma patient, he can see only a portion of the field, not the whole portion. This is called tubular vision. Tubular vision means when this black portion comes in all sides of the field, patient sees like that. As if this is normal. This is on my right side, left side is the normal field. On the right side is the glaucoma field. As if the patient is seeing through a pipe. You can see the center of the eye, but not outside the eye. This is called tubular pipe vision or tubular vision. So this patient should not drive a car. If he drives a car, what happens? He can see straight forward, but he cannot see other cars right side or left side. So there's always chance of accident. How we treat glaucoma? We treat glaucoma by medicine. We can treat glaucoma by surgery. We can treat glaucoma by laser. Nowadays, with advance of medicine, we have a lot of medicine, eye drops, to check the glaucoma progression. Glaucoma progression means the further loss of the optic nerve. Further loss of the optic nerve can be checked by nowadays many types of anti-glaucoma medicine is available. So who are the high-risk patients? Here's the chart. People over age of 40 has always a chance of glaucoma. So if a people is over age of 40, he must do a routine glaucoma checkup. High blood pressure and diabetes. Diabetes and high blood pressure is another cause of the glaucoma. So if somebody is suffering from diabetes or pressure, he must check his glaucoma at least once in a year. High IOP. If somebody is IOP high, obviously he should develop glaucoma. Use of steroid medicine. This is very, very, very dangerous point. What happens? Steroid is a life-saving drug. Steroid is a vision-saving drug also. In many diseases, we have to prescribe steroid eye drop. In many diseases, doctor prescribe oral steroid medicine. And steroid is, is a magic medicine. It is a magic medicine. If somebody suffers from uveitis, we give steroid and patient becomes cured within very short period. If somebody suffers from asthma, patient gives steroid and with very short time, patient becomes normal. If somebody suffers from allergy, doctors prescribe steroid and with short time, patient becomes normal. But what is the point? Next time, if the patient suffers from that same time disease, we have seen many patients do not go to the doctor. They bring out the old prescription and go to the shop, purchase the medicine, steroid medicine, and puts in the eyes or takes orally. So that is called self-medication of steroid. That is the most dangerous in our countries. Definitely in our country. So this steroid, unethical use of steroid, causes glaucoma. It's a main cause of glaucoma. Many patients have to take puffs for the asthma. Sometimes these puffs contain steroid, and this type of patient should check their eye for the glaucoma. Glaucoma developed or not. And family history of glaucoma. This is another point. If father, mother, and upper generation has glaucoma, the if family members must use must do the glaucoma checkup for their own. And if any eye injury is there, any trauma, any ball injury or any type of trauma, there is glaucoma, chance of glaucoma is there. High myopia, the patient who has high minus power, more than 6, 7, 8, they must check their eyesight for glaucoma. And this is mandatory. And other the thin standard retinal, thin central cornea retina thin. This is also. And after surgery, many surgery patient may develop glaucoma. And another cause of glaucoma is the migraine. Many people suffer from migraine. In migraine, there is a vasoconstriction in the forehead and the other vessels in the head. And this vasoconstriction cause disturbed blood circulation in the retina, and that also can cause glaucoma. So in nutshell, glaucoma is due to a high increased blood pressure inside the eye. Glaucoma is a disease which has no symptoms initially. Glaucoma may occur in some certain like diabetes, hypertension, smoking, and unethical use of steroids, etc. Glaucoma can be cured if patient come initially. In case of glaucoma, patient must take the medicine regularly as per doctor's advice, and never stop glaucoma drops even for a single dose. And if somebody is over 40, if somebody takes steroid for long term, if somebody has family history of glaucoma, please go to a doctor, check your eye at least once in a year, and be safe for the forthcoming days. And if you have glaucoma, take medicine according to the doctor. Never drop your medicine without asking your doctor. Check your eye at least 2 times in a year, and follow a healthy life, and take good medicine, and avoid drinking alcohol and smoking. So this is the nutshell about the glaucoma. Now the forum is open for the questions. Anybody can ask questions. We can try to answer about that. Kaushik, যদি কেউ প্রশ্ন করে বলে দাও, but you can also ask.
Yes, sir. Sir, first of all, thanks a lot for this insightful discussion, for this presentation. So this is really great to have knowing about the disease in depth. There are few questions, sir. First of all, that what will be the core message for patients from your side related to glaucoma? Means if a patient has to have remind one message particularly for this disease, so what will be your message for this?
Every year one celebrates a week for the glaucoma. We call the glaucoma awareness week. In this year, in 2021, we are celebrating from 8th March to 14th March. And in this week, we doctors do take lot of activities for the awareness of the people about glaucoma. We distribute handbills, we do processions, we distribute medicine, we do eye checkup camps, etc. Our message is that this, as glaucoma is a life vision-threatening disease, it's very silent killer of the vision, and once patients are attacked from glaucoma, very difficult to control it if they do not follow the instruction of the doctor. Every patient over age of 50 must do an eye checkup for glaucoma evaluation. And if glaucoma is diagnosed, take medicine and follow all instructions as per doctor. Never take glaucoma as light. A cataract is very simple. If somebody suffers from cataract, we do surgery, it is okay. If somebody suffers from detachment retina, we do surgery, that's okay. If somebody suffers from uveitis, we give medicine, okay. But in case of glaucoma, it is a special type of disease. No symptoms, but patient is going to blind in future. So take care of the message. Be careful. Tell everybody, tell your relatives, and everybody be careful about the glaucoma, and take care and do eye checkup. This is my message for today.
Sir, another question is, what are the preventive measures for avoiding glaucoma through dietary means?
Two things should be avoided. One is alcohol and one is smoking. These two causes, alcohol causes the diabetes and other related problems because of the sugar, glucose is there. And smoking causes constriction of the blood vessels that hampers the blood circulation in the eye, leading to glaucoma like problems. And you must take care of your diabetes, take care of the hypertension, and do not take the steroid medicine without the advice of any doctor. And if there is any type of injury to the eye, suppose a foreign body falls in the eye or goes for a eye surgery, must do your eye checkup for glaucoma. And in diet, in normal, a good balanced diet, full of balanced protein and minerals is necessary. Light exercise and good maintaining good health is also very good for this glaucoma prevention. And nowadays, almost all of us use lot of smartphone. So be careful for the use of smartphone. Smartphone and mobile has become part of our life. We cannot avoid it, but their use should be restricted. Use should be scientifically maintained scientifically. It should be scientifically used. And every day, wash your eyes with plain cold water and maintain the good eye health of the vision and vision of the eye. And whenever you read something or do computer or anything, keep the subject distance about necessary distance. And suppose in case of laptop, mobile, 2 feet or something like that, and read under normal and adequate light. Adequate light.
Sir, is there any chance if a patient is taking high protein diet, means it will increase the chance of glaucoma?
No, not that. I mean, not directly, but high protein diet can cause other physical problems, build up cholesterol and other problems. If that happens, that may cause the glaucoma. But directly, I think there is no relation with the high protein diet and glaucoma.
Sir, you have mentioned that if parents are having glaucoma or any of the family person is having glaucoma, so there would be a significant chance that the next generation would be affected by glaucoma. So how is it relevant, means or what could be the prevalence of this?
Now it is proved that if in the family history of glaucoma is a family history of glaucoma, family correlation of glaucoma is very high. It is a established proof. So if somebody has glaucoma, father, mother, or any generation, if the eye is okay, if there's no problem, suppose the people have no problem, still he should take care of the glaucoma, his glaucoma. And if glaucoma is diagnosed, definitely he will take the medicine and follow the advice of doctor. So in case of family history of glaucoma, patients should be out. We have seen in our practice that the people know that glaucoma is a family generated disease. Still, they do not come to us or to any doctor for doing perimetry or checking eye pressure or eye pressure normally. So in that type of cases, please do a perimetry at least once in a year.
Sir, in case of drugs, means patients, how long they have to take these medicines, glaucoma drugs, glaucoma drops, eye drop?
Usually, glaucoma drugs should use lifelong. If glaucoma is established, it should be used lifelong. But what is the reason of giving the glaucoma for lifelong? One point is glaucoma is a progressing disease, very slow progressing disease. So if you stop taking medicine, actually use role of glaucoma drug is two. One is the reduce the pressure of the eye and improve the vision and reduce the loss of field. When the pressure becomes increased in the eye, the nerve becomes lost, nerve becomes damaged. So this medicine prevent the damage of the optic nerves in the eye. So if somebody stops the medicine in between without the consultation of doctor or without checking his eyes, that causes further damage to the eye. And every year, at least patients should do one perimetry to check the progression or the stop or development of the vision. So medicine should be used lifelong as per doctor's advice. And sometimes we prescribe more than one or two or three medicine. They should be used particular time. One, you fix your time according your schedule, in the morning, in the evening, and the night. And at the same time, every day at the same time, use the medicine. At the same time should be used.
Sir, there are large group of patients who are having high myopia, high minus power, which you have mentioned. So for those patients, what could be the frequency where he should check up with the doctor related to if he is having glaucoma or not?
Not only to the relation of the glaucoma. High myopic patient should check his eyes, retina at least twice in a year. Why? Because in the case of the high myopia, what happens? Eye becomes stressed. Size of the eye is more, so the retinal layer becomes stressed. That causes the tear of the retina. That may cause the hole in the retina. That may cause the detachment of the retina. So this high minus power patients must check their eyes in the at least twice in a year. And at the same time, when this type of patient comes to us, this is a protocol to check the eye pressure, to check the retinal the position, and to check the field of vision. So when the patient, high minus power patient, comes to a doctor for his routine or regular checkup, automatically this glaucoma checkup should be done by any eye doctor and physicians. Kaushik, is question
Yes.
from the audience?
Another question, sir. How it can be diagnosed if a child is being affected or glaucoma by birth or not? Means whether it cannot be established that whether he could able to see clearly or not. He can't see that
Glaucoma,
way.
you also glaucoma is the congenital disease. Some people, small baby can born with the glaucoma. In that case, 2-3 things we should take care. In patients, watering is one of the problems, and photophobia means these small babies cannot tolerate the bright light, which is called photophobia, and they cry occasionally. They cry because of the mild pain in the eyes. Water comes from the eyes. In these cases, it's very difficult to diagnose. This patient when come to us, we check their eye pressure, to check the retina status with special machine. Probably in most cases by admitting in the hospital and under a small anesthesia, because these small babies do not cooperate with the doctor. They cry, they become shy. So in a indoor we give some medicine to for the sleep or for short anesthesia and dilating the people. Then you can the machine you can diagnose the child glaucoma. Child glaucoma is definitely very dangerous, very serious, difficult to diagnose, difficult to treat, and difficult to evaluate. Evaluate means what is the efficacy of the medicine we are giving to the baby, to a small baby. So if any child, small baby is born with a glaucoma, extreme care should be taken by the doctor as well as by the parents. Kaushik.
Answer one last question. Current scenario, many of the patients who are suffering with comorbidities. So, what lifestyle they could maintain if he is also being affected with glaucoma?
Please repeat the question again. Repeat the question.
Many of the patients who used to suffer with comorbidities, means other diseases are also there along with glaucoma. So, what could be the lifestyle they should maintain to keep themselves healthy?
I think nothing serious. As they are done in pre-COVID stage time. Nothing special. Only in the COVID situation, putting the drops in the eye may contaminate disease may contaminate the virus. So the vials of the medicine should be kept in a very secure position where there is no chance of contamination. And when you're putting the drop in your eyes, clean your eyes properly, sanitize your eyes, and sanitize the other local portion of the eye also, and then put the drop. And do not try not to touch the eye. Just draw the eyelid and put the drop from above, and take a stale cotton to swab the water or the medicine coming out from the eye, and try not to uh, touch your finger in the eyes. And lifestyle means usually the same lifestyle means normal diet, properly healthy diet, proper rest and light exercise. This all things is good for the eye in terms of COVID situation.
Sir, another thing that I just wanted to ask, that for comorbid patient who are suffering from like diabetes or hypertension, for those the risk factor might be greater compared to the normal person. So for those patients, what will be your suggestion? This is the last one.
The comorbid chance of
The risk factor of affecting by glaucoma, which will be, I think, likely to be more compared to the normal people. The patient who is suffering from diabetes or hypertension. So, sir, for those patients, yes. Okay. So, sir, for those patients, what would be your suggestion?
no, actually, uh, the chance of glaucoma in case of comorbid patient like diabetes, asthma, hypertension, or oral steroid taking medicine is high, no doubt. But uh, that is the check evaluation of the glaucoma, position of the glaucoma, and the maintaining of the medicine. These three things is most important: evaluation, diagnosis, evaluation, and maintenance. So for that three point, patient had to go to a clinic for the eye checkup. For last few months, it was not possible for the patient to go to the doctor or the clinic for doing perimetry or that's called the apnea tonometry, because apnea tonometry is the direct touch the machine in the eyes. And in the scenario of COVID, it should not be done. So, but fortunately, we have crossed that period. Now we are entering the normal time. This in this situation, in this position, the patient who are comorbid or who has glaucoma, now they come forward, go to a clinic where there is no such crowd, and take the advantage of the modern instruments for diagnosis and evaluation of the glaucoma. And another thing, glaucoma medicine, in our country, tropical country, we tell the patient to use the eye drop in 1 month. In 1 month. And the glaucoma medicine is very expensive, very expensive than compared to lubricant, compared to steroid eye drop, compared to other drugs. But we have seen many times the patient use the same medicine more than 30 days. Why 30 days? Because in our tropical country, because of the weather, because of the environment, sometimes the medicine efficacy becomes less. So it should not be used more than 30 or 35 days. But try to use the medicine within finish the medicine within this time. For this reason, the pharma companies make the vial small so that the medicine become exhausted within a month. So take this point. Take this point carefully. Do not use the medicine more than 30 or 35 days. Keep the medicine in a secure position where there is no chance of contamination or infection, and keep it a cool place in corner of the room. And always keep one medicine or two medicine in reserve. Sometimes medicine becomes short in the market, and you should not even lose one single dose for a single day. So preserve one medicine at least in your hand for the time. And in this time, I'll share one thing to my patient about the putting the eye drop, not related to the glaucoma. Many patients, after getting this my prescription, ask one question: Doctor, how many drops? Suppose I have told this medicine put 3 times a day. 3 times okay, but how many drops? Usually 1 drop of medicine is enough for the eye. If this drop spills out from the eye, then put one drop. And how to put the drop in the eyes? Number one, do not touch the tip of the vial. Clean your hand properly and slightly bend your head. Draw the lower lip. Put the drop from above. And old patient, aged patient, never try to put the drop yourself, because that may cause the damage to the cornea. Aged patient, old patient cannot understand. They cannot realize the distance between the cornea and the tip of the vial. So the vial tip touches the cornea, and that damages the cornea. So that in that case, drop should be given by other people with after sanitizing the hands properly. And if you are confident, then you can put the drop yourself, but being slightly lie down, bending your head, put the drop above. And the water medicine which spills out, take a sterile cotton, just swab out. And after putting the drop, keep the eye closed for 1 minute and rub at the corner of the eye, so that the eye do not go, the drop do not go through the duct and works properly. So putting the just putting the drop here, keep this here, so that eye medicine stays over the cornea to be absorbed. Please absorb. This is about the block I drop putting procedure. Okay. Kaushik?